my name is Stephanie Fowl, and I am the Manager of Training and Personnel Development at the ARC of Cape May County. Today, we will be talking about a piece of equipment called a gait belt. On the next slide, you will watch a video with an overview on how a gait belt is used.
The strategies for safe movement of patients, as shown in this video, are general in nature. They can apply to many types of patients, but may need to be modified for certain diagnoses, impairments, or precautions that a given patient might have. Thus, for a specific patient, the strategies shown may need modification. If you are unsure of how to safely move an individual patient, it's recommended that you consult with the occupational or physical therapists at your facility. Whenever assisting a patient with movement, it is important to instruct the patient in ways that they can assist with the movement. If the patient knows what to expect because you are communicating with them, they are less likely to move in a way that may come as a surprise to you and throw off your own balance. Also, instructing them how to assist helps promote their independence in completing the movement and makes your job easier, as you may not have to provide as much physical assistance. This video will cover the rationale of using a gait belt, also known as a transfer belt, how to apply it correctly, and how to utilize it during a simple sit-to-stand transfer. I'll demonstrate the use of a standard canvas belt with a metal buckle. These canvas belts can be laundered and therefore used for different patients. There are other variations of gait belts that can be used, such as vinyl ones, or ones with plastic buckles that would be appropriate for use in radiology. The purpose of the gait belt is to help you control the patient's center of mass during movement of the patient, control their descent should they begin to fall, and eliminate the need to hold on to the patient's clothing or under their arms. Holding or lifting under a patient's arms can lead to injuries to the patient's shoulder, particularly if the patient starts to fall. One of the first things that you may want to do is explain the gait belt to the patient and why you're using it. When you apply the gait belt, it should be positioned low around the patient's waist, near her center of mass. The end of the belt goes through the buckle, through the side with the teeth first. Then, push the end of the belt through the second opening of the buckle. The belt should be applied fairly snugly on the patient, tight enough that it won't slide up excessively on the trunk when the patient stands up, but loose enough that you can slip your fingers underneath the belt. In general, you should place the belt a little tighter than you might think with the patient sitting. It tends to loosen up a bit once the patient is in standing. Sometimes you will need to tighten it further once the patient is in standing. When holding onto the gait belt, grasp it so that your fingers are coming up under the bottom edge of the belt. Don't hold it from the top edge. If the patient begins to fall, you will likely lose your grip if your hand is positioned this way. Next, you'll see how I'm using the belt to assist the patient into standing. The patient must lean forward to shift her center of mass over her base of support, which is in this case her feet, as she stands. I'm using the gait belt to guide the patient's center of mass forward. I'm not pulling straight up on the belt. Rather, I'm using it to help direct the patient forward and up on a diagonal. To assist the patient back into sitting, I'm going to make sure she is in contact with the bed, reaching back with her arms. I'm using the gait belt to control the descent of her center of mass as she sits. You do need to be cautious if the patient has incisions or lines, such as feeding tubes, in the abdominal area. Usually in this case, it's best to apply the gait belt higher up on the trunk to eliminate the chance of the gait belt sliding up over the incision or line. However, it's less ideal in this location because it no longer is located near the center of the patient's mass, where it is best used to control the patient's balance. You may also need to be cautious when applying the gait belt to female patients. Unless there is a contraindication to placing the belt on the abdominal area because of an incision or line, make sure the belt is placed under the breast tissue, not over the top of it.
At the ARC of Cape May County, we use the Comfy Spot belt. This is used as part of a total fall management program. This should only be used as authorized by the results of a person's risk assessment. The gait belt is used to assist in safe transfers and ambulation for a person. It is also used to help prevent injuries to you. The Comfy Spot belt is wider for greater contact area with the wearer. As you will see on the next slide, it also has multiple vertical and horizontal hand grips that allow the caregiver to choose the best leverage point. This is a Comfy Spot gait belt. It is used as an effective aid when lifting, walking, and transferring. At no time is the belt to be used as a restraint to secure someone to a chair, bed, or stationary object of any kind. Make sure to assess whether the person's size and/or weight will require more than one person to safely lift, walk with, or transfer the person. When in doubt, 2 caregivers should always be used for the person's safety. To use the gait belt, position the belt around the person's waist, never around the chest. Adjust the belt length to fit securely around the waist. Make sure the belt is snug but not uncomfortable. You should be able to slide your hand flat between the belt and the person. Secure the quick release buckle together by inserting the male side into the female side. The belt is now positioned for use. Use both hands to firmly grip the belt using the attached hand grips located along the back of the belt. If 2 caregivers are required, position one on either side of the person. You are now ready to safely lift, walk with, or transfer the person. The Comfy Spot belt can be washed. Make sure not to use water that is more than 170 degrees. Do not use bleach on the belt. Dry the belt on the medium setting and never use a water extractor on the belt. Now you will watch a video about how to use the gait belt to assist someone into and out of the vehicle.
Transferring or moving a loved one from the wheelchair to the car can be a challenge for caregivers. How do we do this? What is the safest way to do so? This task may seem daunting, but following a few key steps makes it relatively simple. This simple video helps answer these questions and provides basic steps on how to move someone from the wheelchair to a car and from a car to the wheelchair. Taking a wheelchair-bound loved one outside of the home may first require the caregiver to get them into a car. Before starting the transfer, it is important to remember a few key things. First, be prepared by gathering any items you need before you start. Have your keys, gait belt, and any other items handy before you go outside. Move the car to a location that would allow easy access for the wheelchair. Protecting your back from injury should be part of every transfer. Good body mechanics involves bending your knees during the transfer and maintaining natural curve in your back. There are many different types of wheelchairs available with many different features. Some chairs have footrests that flip up. Some have leg rests that can swing out of the way. Getting the wheelchair ready and in the right position will make the process go smoother. Wheel your family member from the house to the location of the car. Before starting the transfer, open the door, place the wheelchair at an angle and as close to the car as possible. You should lock the brakes for safety. This will stop the wheelchair from rolling away when your loved one stands up. Have the individual lean forward and apply a gait belt or other belt. The use of a gait belt provides increased safety by allowing you to hold onto the belt rather than an arm, which may cause injury to the individual. The belt should be applied around the waist, below the rib cage, and above the hips. Getting in and out of the car may mean working in a tight space. To give yourself more room to perform the transfer, swing the leg rests out of the way. Moving the car seat back as far as possible will also give you more room to get the individual into the car. Next, assist the person to move to the edge of the chair and lean forward. Leaning forward shifts the person's weight forward over their feet and will make it easier for them to stand and transfer. To prevent you or the individual from being injured,
You should avoid having them hold on to you. Instead, you should have them place their hands on the armrests of the wheelchair and push up. Get a good grip on the gait belt and help them to stand. If your loved one's legs are not strong, you can block their knees with your knees while they stand up. Guide the person to pivot and turn with small steps and back up to the car seat. Instruct your family member to bend their knees and slowly sit in the car seat. You should remind them to bend their head forward to avoid hitting their head on the frame of the car. To complete the transfer, help the person turn and assist in lifting their legs into the car. Finally, apply the seatbelt and close the door. Getting out of the car is the reverse process. You should position and angle the wheelchair as close to the car as possible. Lock the brakes to prevent the wheelchair from moving, and swing the leg rests out of the way to give you more room to work. Next, unsnap the seatbelt. Assist your loved one to turn their body, lift their legs out of the car, and scoot to the edge of the seat. Get a good grip on the gait belt and help the person to stand. If your loved one's legs are not strong, you can block their knees with your knees while they stand up. Guide the person to pivot and turn with small steps. Have them reach back for the armrest and sit in the chair when they feel the back of the chair. When your family member is comfortably seated in the chair, place the footrest back in the original position, unlock the brakes, and you are ready to go to your destination. We recognize that this is not a simple task, and you may need to watch the video more than once. This video provides the basic guidelines for transferring an individual in and out of a car. Everyone is different and may have different requirements or need specific precautions based on their medical condition or diagnosis. This video shows how to work with someone who may be able to assist during the transfer. These are general steps that may be taken. Your loved one may need a more individualized evaluation to determine the safest method of transfer and any other equipment. In either case, we encourage you to seek professional information by contacting your physician or other licensed healthcare professionals for specific guidance on your individual situation.
If you have any questions, you can speak with your program supervisor or anyone at the training department. Thank you for watching. Please click the X on the top right corner to exit this presentation. You will then need to click on Gait Belt Training again to have access to the post-test. Please make sure to complete the post-test to receive credit for completing this training. As with all tests, you must receive an 80 or above to pass. If you are having difficulties, please contact the training department.